We're going to talk about numbers, and you have this very important role of telling us why numbers really matter. But perhaps tell us, what is it you do? Just a quick outline in terms of the work that you really do.
Thank you so much, Ashraf. Before I answer that, let me first thank Shabir and everyone at Lunar Capital for having me. We're currently experiencing a supermoon, and I think it also ties in quite nicely with the super event on a topic that I'm quite passionate about. So thanks so much for the invite and for having me. Ashraf, I'm currently a senior researcher at the CSIR with a background in engineering and applied mathematics, and also an associate at the University of Johannesburg and the National Institute for Theoretical and Computational Sciences.
Some words at some famous establishment in the UK. Tell me about that.
So I spent some time in the UK completing my PhD studies.
It's not giving us any names, no name dropping.
No.
Oh, you have to Google it and find out for yourself, right? Well, whatever it is you've done before, you have to accept your name is now very much linked with the COVID landscape in South Africa. Yet you're not a medical person in that sense, although I call you Dr. Ridhwaan Suliman. What happened to you? Something happened around you and numbers and the COVID numbers that triggered something for you, and you did what?
So numbers do matter. Numbers help us to quantify observations, to understand situations better, and ultimately to make decisions that hopefully can improve our lives. When COVID came about, it was a data-driven pandemic. Everything that we observed was being quantified by numbers, the number of infections, the number of hospitalizations, and the number of deaths. However, that wasn't being shared in a way that, for me, didn't quite tell the story of where we were at and where we were headed.
As the member of the public in that case? Yeah?
Yes. As someone just observing during a hard level 5 lockdown, what is the situation? Are we coming out of a level 5 lockdown after 3 weeks? I couldn't tell that just looking from the daily numbers that were published. So I decided in my personal capacity to track the numbers and understand the trends.
And that was not part of your brief. I mean, that's something you did on your own.
That's correct. So I did this in my personal capacity and started to share this with initially friends and family, and then thereafter on social media. Okay,
so there you are, a numbers activist, right? How did, to cut a long story short, what happened when you did that? What happened to you and the broader South African public?
So it certainly took on a lot more attention than I expected. I initially just wanted to share this with friends and family, and for anyone who's interested in better understanding the COVID-19 pandemic situation in the country. It gained attention from media to other industries, eventually became part of my job where I helped to share the data at decision-making level.
And what it proves once again, if we didn't know that before, is that numbers matter, but numbers explained matters, and numbers matter well when we make informed decisions based upon those numbers, which at that stage, before you started doing what you did, all of us were seeing those numbers and 5,000 people are infected, 10,000 people are, they meant very little. We couldn't really grasp it. So what I'm going to do, I'm going to indulge you for the next 20 minutes or so, right? And I'm happy to get the public as well to also post questions and comments. You certainly can do that, so you can just post it in the chat line right away. Comments, questions, whatever it is, around the broader scheme of or theme of why numbers matter. So I'm going to indulge you to explain, first of all, seriously, why do numbers matter?
So as indicated, numbers help us to quantify observations, to give us a quantitative analysis to help us make decisions, make comparisons, and ultimately improve our lives. I think that's simply why numbers are important.
And you've got some fascinating examples. Naturally, we're going to start where it all started for you with COVID-19.
Yeah, so COVID-19, understanding what the numbers mean has helped us to understand the pandemic. And a way of communicating the numbers is through graphs or visuals. And I've tried to share these numbers around COVID through graphics and visuals. Perhaps if I may, I'd like to bring up a slide showing the epidemiological trajectory of COVID-19 in South Africa.
Okay, go ahead.
So the graph here shows the number of infections in South Africa since the start of the pandemic and highlights the 5 waves or surges of infections that we have experienced. But I just want to highlight 3 aspects of why data matters in terms of the COVID-19 pandemic, but in the broader sense of how data and decision making is still relevant coming back to the finance and investment space. Firstly, if we look at what happened back in March 2020, we went into a very harsh level 5 lockdown without any data. That decision was made based on anecdotal evidence or data and evidence that we were seeing from countries globally. Over time, we've had more data to help us understand where we're at in the pandemic, where we were experiencing surges, and that helped us to inform interventions and policy to try and mitigate the spread of infections. So the important point is data does matter, and data helps us to understand and drive decisions. Secondly, we must understand that yes, data is good, but it's not always just as simple as that. Data does have limitations, and over time, those indicators that are used to drive decisions vary. For example, early on in the pandemic, we were tracking case numbers and infection rates quite closely, but we never understood that those case numbers related to the testing rates that we were doing. So the more people got infected, the more people presented for testing, the more infections we were seeing. But we needed to understand that the infection rates also tied in with how much testing that we were doing, and so that proportion of tests that were positive, or the test positivity rate, is crucial in combination with the actual number of cases.
And you were the first people, if I can recollect, who started focusing on positivity rate.
100%. For 2 waves, we went through almost a year where this indicator was not made publicly available. Fortunately, as we reached the 3rd wave back in the middle of 2021, this particular indicator started to be published more widely. We probably overcompensated and spent too much focus on the test positivity, forgetting about the actual number of infections. But the idea is that both the actual rate of infections, the absolute number, and the test positivity are important in making those decisions and understanding where we're at in the pandemic. But going beyond that, what happened in our 4th wave towards the end of last year is we saw a rapid surge in infections, with a growth rate of infections doubling every 2 days because of the most transmissible variant, the Omicron variant that emerged. We saw the test positivity rates as well also reach record levels. However, if you look at the vertical lines towards the right of the slide, you'll notice that we never went into harsher lockdown levels, rightfully. And the reason for that is, although we were seeing much more infections, there was a decoupling and significantly fewer hospitalizations and fewer deaths. So the point being that over time, the indicators and the numbers used for decisions changed. The final point to make around the importance of numbers and decision making is the timing in which the decisions are made. Unfortunately, in South Africa's pandemic situation, the interventions and the restrictions that were implemented were reactive and probably too slow to be most effective, and ultimately weren't as effective as they should be. And this can be confirmed by the fact that over 90% of South Africans have been exposed to the virus thus far.
And therefore, and I know you're not, I mean, that's not just the medical side of it, but I mean, the great lessons, therefore, to learn, to share with the South African public now around the numbers in COVID?
So I think threefold: the importance of having data and having access to data, understanding which indicators are relevant at which point, and then ensuring that decisions are made timelessly and made with the right time frame so that they can be most effective.
And I mean, part of the decisions is getting the data, which is the numbers, and then being able to analyze those decisions well to make really sound decisions, isn't it?
100%.
Yeah, big issue. Now, that's not all in terms of numbers. You have more to tell us, right?
Yeah, so I think I just want to step back beyond COVID. We understand that COVID has been the focus for the last 2 years. But we need to understand that prior to COVID arriving, South Africa has had a burdened healthcare system. We have many communicable and non-communicable diseases that have placed a heavy burden on the country. So we can't forget that the HIV pandemic continues to create a burden, and also TB has been the leading cause of death in South Africa. Unfortunately, because of the emergence of the COVID pandemic, our shift and our resources have been allocated to manage that and create extra burden.
And I think that's come up in the past. It's, okay, now we understand the COVID numbers, huge emphasis on that. I mean, it's been part of the daily bulletins. I mean, you've tweeted regularly, etc. Now it's like, hold it, we actually need data, and they're available for a whole range of other issues, and that's what you're telling me.
Yes, and we do have data. It's about the context and understanding. And we know that TB deaths, there are approximately 61,000 deaths due to TB in 2020. And similarly, in the years preceding that, it has been the leading cause of death. That equates to just over 167 TB deaths per day, which is significant. And so, unfortunately, we still have to pick up the slack and the burden and manage that in context, that COVID is not just the be-all and end-all. There's
so
other
aspects.
aspects.
Graph right now. You're going to talk us through some of that you've just explained?
I've just shared that now as we talk.
And I mean, what do you think? I mean, in terms of policies and therefore decision making based upon that. Again, it's not your space, and I understand that, but your space is to deliver numbers, right? Are sound decisions being made around all those issues? You've listed about 10 or 15 different items, right? Outside of COVID-19, starting with HIV?
Well, I don't know exactly what decisions are being made in terms of non-COVID related issues, but in general, I don't think we're using the data sufficiently at a policy level. I think we can do a lot more to bring forward the data that we have at our disposal to drive the decision making.
Okay, the other big data issue is like load shedding.
Yes.
What time is it on? What time is it off? How does it affect our lives? You've got some stats on that.
Unfortunately, load shedding is a very topical problem and challenge right now. And there's a lot of baggage and politics behind the situation. Maybe by showing this graph that I have here, just identify a couple of trends as to what the numbers around load shedding are saying. The graph on the left shows the amount of load shedding that we've had over the past decade. The focus should be on the last few years since 2018. There's been a consistent rise in the number of hours of load shedding that we've experienced in the country. And coupled with that is the severity of the load shedding that we've experienced. Over time, we've had much more energy being shed from the grid. These graphs are courtesy of my colleagues at the CSIR. Just to add to this graph, what isn't shown here is in 2021, we're only in July this year, we've had more load shedding this year already compared to any of the previous years in terms of both the number of
numbers, yeah?
in terms of the number of hours, but also in terms of the energy shed. We're already at over 3,000 gigawatt hours of energy shed this year, which is much more than any of the previous years, and we're only just over halfway through the year. So that's one trend to take note of. The graph on the right is another trend to understand, and that's the energy availability factor. And there are seasonal effects over time, but essentially what the trend is showing is a downward availability of energy. And so just looking at these two trends, it's clear that we have a problem. We have a national crisis. The data is there. What we need now is an intervention or some sort of decision to stop that trend, to turn that around. We're hearing that possibly there will be another family type of meeting to address this, but the data there is...
Almost a state of national disaster around energy only. Yeah?
Yes, and the data is clear that it is an issue and something needs to be done to turn this around. And it's not a surprise that we're experiencing stage 6 load shedding, and there's even a risk of stage 8, unfortunately. So the data is clear and decisions need to be made based on that.
Now, again, you may not have this right now, but I think people watching us would say, well, like, is there data that tells us, like, if you look at the COVID example, how COVID can be positive, but you don't have to die. And the vast majority of the people did not die, although many did die, right? But so in load shedding terms, do we have data that tells us how it's affected individual families, how it's affected productivity, how it's affected profitability within companies? I mean, do you have that? Is there something that needs to be looked at?
I don't have the data myself. I'm sure there are possibly indicators, but it's a really important point. Beyond it just being a national crisis, it's more than that. It's affecting people's businesses. Many people probably in this setting, their businesses are being affected. You need to take into account ways to mitigate load shedding, which has overhead costs or initial costs. Beyond that, it affects people personally. What we want is people to have access to electricity, to be able to have affordable access as well. And what load shedding is doing is denying people that right.
Yeah. And I mean, that's the point that you've made, that we can talk at a macro national level, and that what that does, it creates a doomsday scenario, and sometimes rightfully so, because it does create an awareness. But ultimately, for people even watching us right now, it always matters in terms of how it impacts upon them directly, right? The same happened with COVID, and the same now with load shedding.
Yes, 100%. There is the bigger picture, but then ultimately there is the personal focus. How does it affect everyone individually? Okay. And I think that is important.
All right. Well, I think there's maybe a lot more that will come out of that conversation, if not today, maybe some other time. And I look forward to seeing some of your graphics on Twitter in that space particularly, right? What else have you got? You've got something around lifestyle issues, because we were talking about numbers off the air, and I mean, we can look at a range of issues: inequality, crime, murders, deaths, unemployment, all those numbers. But you have an interesting take around that, around context, right?
Well, yeah, it's an interesting question when we discussed the theme and discussions prior, why numbers matter and what numbers matter. I can easily start quoting that we average 67 murders per day, that there are 120 rape cases per day, or the unemployment figures of 35%, or depending up to 45, using whatever criteria you use. But I decided to take a step back and understand all of those absolute numbers have negative connotations, and we already have heard of all of those numbers in the news and in the media. So maybe philosophically we need to ask ourselves, why do we focus on events and individual numbers, particularly in the news and the media? So I'd like to just maybe take it a step back, an opportunity to understand what other indicators are there that we can use to measure progress and to measure whether our decisions are having an impact.
Looking forward to that. And before we get to the first one around child mortality, let me just encourage you as well. Questions you may want to put to Dr. Ridhwaan Suliman, feel free to do so. Drop a question, drop a comment around the broader issue of why stats matter or why numbers matter. You can do so. There's a good chance we could pick up some of your questions just after we complete the presentation around the slides. Okay, go ahead with the child mortality then.
So the slide that's up here at the moment shows an indicator relating to child mortality in South Africa. It's reflective of the healthcare system in the country. And what you'll see is generally a downward trend in the mortality of children. There is an upward trend in the early 2000s due to the HIV pandemic, but also because of our policy and denialism around the HIV pandemic, which resulted in a higher child mortality rates. But in South Africa right now, the child mortality, even though it's over 40,000 deaths, it has declined and more than halved compared to where we were at just 15 years ago. So yes,
so that's a good example of stats. That's actually good news.
It is good news, but it also depends on how you look at it. Yes, it's progress. We have less than half the number of child deaths that we had just over 2 decades ago. But is it good enough? So in South Africa, we average just over 100 child deaths per day. But in some countries, that rate is less than 1% of the number of newborns. So yes, we've progressed, but we can still do better.
And there's a whole lot of red markings there, sadly, predominantly in Africa and also South Asia, right?
Yes. So if we compare to other more developed countries, I think there is still scope for more progress. Maybe if I look at the next indicator, and what's important is the level of freedom and democracy. So South Africans, we do complain a lot, and rightfully so in certain settings, but what does the data say? And the graph here at the bottom shows an index representing the level of democracy or freedom in the country. And what you'll see is that South Africa, according to this index, has a 70% level of democracy currently in 2021, compared to just over 20% in 1990. That's significant progress. Even more so, it's above the world average and above Africa's average. So if you look at that trend, yes, we are a relatively free country, and that's progress.
Okay. Something to take a note of. Yeah, go ahead.
Quickly, to maybe look at one or two more general indicators. The graph here shows the share of population in extreme poverty. Now, extreme poverty is quite extreme. It's measured as the people living off less than 1.9 international dollars per day. Generally, what I just wanted to highlight is that the trend is downward globally. So globally, we have made progress, and there are less people that are living in extreme poverty, and that's good. The trend for South Africa is not so clear, but it is decreasing compared to where we were at a couple of decades ago. And maybe just to end on one more indicator or example of progress, this graph here shows the level of income or income inequality. We know, and it's based on this Gini coefficient of inequality, we know South Africa is the most an unequal country in the world, unfortunately, and it's clear from the trends that are shown here. But
perhaps explain it if you can. I mean, we often talk about this Gini coefficient. I mean, what does that measure?
It's just showing the discrepancy between the level of wealth. We have this very big gap between extremely wealthy people and a huge population that are living in poverty.
So you could get other countries that they are on average much poorer, but what they don't have is the division between rich and poor, and that poses its own social problems.
So it's the discrepancy between the rich and the poor, exactly. So South Africa has a very high level of inequality, but what the data is showing that this has been consistent over a very long time. So it's not that it's gotten worse or gotten better, it's just been bad for a long time. Essentially through what these different indicators are saying is that there has to be context to how you look at numbers and how you look at data, and over what time frame you picture it. So I think if you want to try and understand progress in the country, you can look at absolute numbers, as we're saying, murders and crime rates, or you can look at other indicators and what the trends and the progress has been. So the context and the timing and the time frame is important. And I hope that also ties back into investing and finance, where you make decisions and want to understand the implications and the effect of those decisions over the time frame, whether it's a short-term investment, a long-term investment, context does matter.
Because it does show once again, I mean, and we'll talk to Shabir Munshi just now again, that numbers is the true measurement of just about most things we do. In the absence of that, we'll just be guessing, isn't it?
Ultimately, we need numbers to quantify where we're at, to quantify decisions, but there also needs to be context and understanding of what numbers are important and when.
Okay, I'll tell you what to do. I've asked people to comment or ask questions, and they can do so. And if there are, we'll take them right away. If you don't, it'll just mean I've got 3-4 minutes more to talk to Dr. Ridhwaan Suliman about his own fascinating journey in terms of how it all started, right? So one of them, yeah, this is interesting. Are there any numbers to show how brain drain is affecting productivity and progress research in South Africa? And we'll take you to the Minister of Stats, or from Stats SA. I'm introducing you as that anyway. Any idea you have anything?
I don't have, unfortunately, per se. It is certainly an issue. We do know there's brain drain. I'd have to go back and do some homework.
Yeah, and it must affect things, absolutely. Perhaps, and again, chance for you, further questions, comments, feel free to do so. Otherwise, I want to get to Ridhwaan's story. Well, perhaps talk to me about that. I mean, how did you get into this journey in the first place? Like your, not just in terms of COVID, I mean, your actual career. How did it all start for you?
So I have a background in engineering, and my career sort of moved into applied mathematics and more theoretical background. But I've just found myself during the start of the pandemic trying to understand the data and the numbers. I am quite passionate about numbers and the importance of numbers. And so in my personal capacity, decided to track the numbers and understand where we're at for COVID-19 specifically.
And what for you then is the magic around numbers? Let me explain that. You know, somebody who's a singer or is a musician or is a poet or a writer, there's a certain magic they feel. I sort of describe myself as a conversation architect, and so like, what the heck is that? I know what the magic is around that. What's the magic for you even growing up and then adopting it as a career around just understanding numbers?
I think for me, just numbers make a lot more sense to observations, and numbers help us to just understand, or for me, helps me to understand situations better. And so I just naturally lean to trying to get...
But even as a I'm going to use the word, as a lightie, when you were growing up, you felt it already?
No, definitely. It's always been around numbers.
Okay. And perhaps last thing, because we don't have more questions, so we're going to leave it at that. Perhaps the last thing, advice to others who are watching us and now hopefully are hooked onto the need that numbers and data, and then using data to make informed decisions really matters. What advice would you give them?
I think maybe just to also add to the previous point, numbers for me are non-emotional. So it takes out that factor in terms of understanding and also in decision making. Advice, I think one needs data to make decisions. Otherwise, for me, it's not fact-based. And also, once you get data and understand trends, you can make informed and non-emotional decisions.
Okay, here's what I want to leave you with before I leave you or you leave me, right? You've tweeted about this, right? That around this very important issue called load shedding, when we had the issue around the strikes, the so-called illegal strikes, government or Eskom were very quick to say, in fact, it is the strikes that precipitated the move that's declining to stage 6. You, in fact, and you're not the only person, you've sort of argued against that to say, statistically, and that's why you're not saying it what you felt, statistically it suggested that's not the case. Tell me about that.
Yes, I think it's quite clear from the data and the trends that we were experiencing more hours of load shedding, more severe load shedding, and that trend was only moving upwards. And if we look at the trend in the data of energy availability, that trend was only moving downwards. And so it's no surprise that the situation has been getting worse, that we have experienced stage 6 now, and stage 8 is also a risk. So yes, the strikes may have exacerbated the problem, but it's not the sole reason for why we have experienced stage 6 thus far.
And therefore, when you have darkness, perhaps you need to find that moon that we spoke about. That's why the illumination from lunar will perhaps help us in this case here. Ridhwaan, listen, great chatting to you. Very, very enlightening. I'm going to suggest that people follow you, so perhaps on Twitter. For those that don't get hooked on, what's your Twitter handle?
It's at Ridhwaan, R-I-D, the number 1 tweets.
Okay, so Ridhwaan, you notice that? Numbers once again, Ridhwaan tweets. Hopefully you've learned so much. I think it's just been absolutely fascinating. But I have a sense that certainly where Ridhwaan Suliman comes from, right, there's a whole lot more around his understanding of numbers and simplifying numbers to the broader South African public around, let's call it current affairs, issues that effectively prick your life, that will come up not just today, but I think in the months ahead. And therefore, I'd be very comfortable saying, Ridhwaan, you are a national asset, as is proved during COVID-19. Thank you for your time.
Thanks so much, Ashraf.